Thank you for having me here today. I'm Dr. Snyder. I'll be giving a talk on the changing perspectives in healthcare system today. With a show of hands, who's enjoying the speakers and performers so far today? All right, how many of you can understand what's happening with the healthcare system today? Okay, let me just try this again. Hello, I'm Dr. Snyder. I'll be giving a talk on the changing clinical perspectives in healthcare today. So what you may have just experienced is something that has happened to you before. So how many times has anybody in here gone to a doctor's office and felt like the doctor was more concerned about the computer or something that they were working with that day than you? Okay, so what I'll be talking about is how technology is changing and shaping healthcare. So while this is happening, there are a lot of great advances as well as a lot of great shortcomings. But, I mean, as you've just heard, technology is really driving a lot of things, and even healthcare is one of them. So you can't neglect the changes in medicine, surgeries, the different prosthetics and implants that people have, as well as things with cancer treatments and organ replacement therapies. But once again, technology is driving healthcare, and that is leading to some great shortcomings. So what does this mean for your doctor? Well, it's changing the doctors from doctors or clinicians to technicians. So there's somebody that shows up, operates the machine, takes 10 seconds to look at you, and walks out of the room. Now, if you compare the two entries, a lot of people would say that the first one was terrible, and it'd probably be correct. So what we're going to do is focus on ways in which that this is making the change. So the next most prevalent thing in healthcare that everybody probably can associate with are sounds. So what I want everybody to do is close their eyes for me really quickly. And I want you to imagine walking through a parking lot. And I want you to imagine a car alarm going off. What did you do? Did you pay attention to the car alarm, or did you just keep walking? You can open your eyes now. But most of you, if you're walking through a parking lot and you hear that alarm, you're just going to keep going. And every day in any doctor's office, there's going to be timers going off. There's going to be alarms for various things in the office, pieces of equipment. If you're in a hospital setting, there's a lot more going on and a lot more sounds. And this gets into something called alarm fatigue, or the cry-wolf effect. In 2012, these were the leading causes of technology health hazards in our medical system. So what is this? It's very similar to that car alarm experience where you just don't react to something in your environment. And if this is in a hospital setting, you could be not reacting to a patient who is pushing their buzzer, maybe looking to change their bedpan or just needing a little help, assistance going to the bathroom, or even somebody who could possibly be coding. So if you can imagine what could happen in that brief period of time, or that delayed response that nurses, doctors, even people outside a hospital setting who are dealing with things that could potentially burn patients, this delay can lead to somebody getting a little bit damaged. And so going back, older is sometimes better, but while this is going on, we're looking at other reasons or why things are changing the way they are. And I say older is sometimes better in healthcare because I'm going to have everybody take out their cell phones now. Yeah, take out your phone. Take a look at it. So a lot of you have smartphones. It's really hard to see because of the lights, but I can still make out that a lot of you have camera phones. And with the changing technology, a lot of you probably have an Instagram account or anything where you upload these pictures online. Now, if you can remember maybe 10 years ago what a cell phone camera was, it maybe had a third, half, a tenth the power or the resolution that your current camera has. Our healthcare system is doing the exact same thing with our imaging technology right now. X-rays are a great example of this. Right now, X-rays are 3 times less defined for digital film than a lot of the plain film radiographs that doctors and clinicians can look at. So what does this mean? We're looking at pictures that depict a change in a person's body, the tissues. And if certain conditions require an advanced amount of tissue change, such as cancer or tuberculosis or other things that are changing cell structures, what if we can't see that definition early on? Will that delay in care impact a person's health care? Could that impact maybe you one day? So what we're going to do is go on from there. What is this going to keep doing to the patient? Now, in recent studies, there have been a lot of things looking at back pain because, well, 80% of Americans, roughly as an estimate, are going to be experiencing back pain at some point in their entire life. So, if 80% of people are going to be experiencing back pain, we're becoming clinicians. We're using X-rays a whole lot more. We're also using things like MRIs a whole lot more. Now, this study that was done by the Journal of Athletic Training took a look at 2 groups. One group had early imaging. One group didn't have any, and they were treated just based on that doctor's clinical impression. I would like you to take a second to just think to yourself what those outcomes would be. Who here thinks that the people who had more images had better treatment, less time in care? So some people are agreeing with that. You can keep that kind of to yourself. No. So really, what happened is the exact opposite. The people who had more imaging had decreased outcomes. And this wasn't because of their condition. These were all very similar cases of generic back pain. What also happened was the time that those people were in care increased, as well as the cost to that individual patient. So, why is this? It's a pretty complex thought process considering we have this great image. In most cases, the doctor has a really, we think, good idea of what's going on. But why? So, what I'm just going to read really quickly is a quote from another article out of a journal, Spine, from 2013. This little quick tidbit is, independent studies had independent iatrogenic effects from non-indicated early MRIs. So what does this mean to most people who don't understand medical jargon or long words or just don't really want to bother with that? What it means is the pictures that people saw had a damaging effect on not only them, but their doctor's impression of what was going on with them. So to give you just a general idea of the amount of increases that could potentially happen in terms of costs, another study took a look at people who had back pain with radiculopathy. What a radiculopathy is it's numbness and tingling going down an arm or a leg based on a nerve root. So in these studies, there was an early MRI group and an MRI group. The MRI group, on average, was costing the patient $12,000 to $13,000 more in money take a second to think about what you could do with $12,000 to $13,000, especially since 80% of us are going to wind up with back pain at some point in our life. So the next thing that it really impacted was time away from work, or time from treatment, or time on disability. These patients took longer to get back. So you could be in pain longer if you have these images. So, what's the point? The point is that looking at these images can have a damaging effect. Relying so heavily on technology versus using our best clinical judgment is potentially harmful to our patients. So doctors in training are focusing so much on these tools that they're becoming technicians rather than doctors. They know how to use these machines far better than they do to look at their patient and take their judgment to the next level. So I'm going to leave you with one question before I go. Thank you for your time, but how will you let these changes affect you? Thank you.